Hello, good evening, Dr. Charles and my fellow classmates. My name is Jennifer Champong. This video is based on week 2, subnote, musculoskeletal. This week I had a chance to meet a gentleman who came to our clinic unaccompanied. Came in, his name is JT. His date of birth is 3/12/1988, which happened to be in his age of 37 years old, and he is Hispanic, white male. The chief complaint was close to close, my right knee hurts when I walk. So JT, as a 37-year-old Hispanic male, came to the clinic with the chief complaint that his right knee hurt, is in severe pain, which started 3 weeks ago, and based on a new routine of exercise or running that he has been started. The medial right knee pain seemed to be consistently and increasing severely with the activity that keep on really be a dull or a sharp pain, and when he bends it or maybe when he's climbing the stairs. He been using rest and an ice to relieve the pain, but still the pain is still getting worse. He also denies any fever, any redness around the area, or a lacking or any trauma to the knee. So we asked him, what does he take? He said, oh, I do take ibuprofen, 400 milligrams when it's needed for the pain. So based on the pain level, he was 6 out of 10. And then I asked him, has he had any past injury to that knee? He said no. Then any current medication that he is taking? He said he's taking Lisinopril for hypertension. Is he allergic to any medication besides that? He said no. That's the only medications that he been taking, with the Lisinopril and the ibuprofen that he does take for the pain. So there is no any other medication allergy to, not allergy to any environment or any seasonal allergies, none of the above. So the past medical history that he does has it currently is a hypertension, taking Lisinopril, and he has not been in a hospitalized or maybe any surgeries, never, none of those that he has been. And then all his immunization also is up to date. So with that, we decided to have a real focus about the assessment on him. So based on that assessment that we did as the musculoskeletal, we tended to do the assessment on the right knee. So during the assessment, the knee seemed to be tenderness, feeling the pain on the medial lateral joint line. And then there was no redness, or it doesn't feel warm. The range of emotion was perfect. There was no loss of range of motion on that knee, but it was really painful when we flex it at more than 90 degrees. We also used the McMurray test, which also came to be positive with the medial, but with the posterior and an anterior drawers all denies there was no pain. So the left knee also was normal comparing to that. So that is the special test that we use it to conduct. There's other tests that we also decided to do while we were on a right knee x-ray. The x-ray also came out just to make sure that if there's any fractures or any dislocation, or the joint space is narrowing or it's closing, we just have to use that to rule out any acute fracture on that knee or any mild degenerative changes. We used that, and then the result was no fractures. So based on the assessments that we conducted, I and my preceptor, we conducted. When I say we, I and my preceptor conducted, we came as a result of the right knee pain. What are the three differential diagnoses that we came out with? Was one, it was a medial meniscus tear. The medial meniscus tear with the reporting of the knee fraction pain that the patient was exhibiting. And then the positive result that we have using the special test, which is the McMurrow test. Based on that evidence, as the witness after running, then it became really severe pain for him. Then we decided that, okay, that also can be another differential can be used. The next differential that also came up was knee osteoarthritis. But based on that, there was no stiffness on the knee, which also tells there is early degenerative joint diseases if there's any stiffnesses on that joint. That also helps to rule out. The third diagnosis that also came out with was medial corollary ligament spleen. That also was used to rule out the pain because there was no when the exercise is ongoing, that is when the patient feel the pain. But nevertheless, this is not something that had no trauma to the knee, so we didn't even we ruled out that as well. And so my primary diagnosis that I came out with was right medial meniscus tear, based on the assessment that it was done on the patient. The plan that we decided also to do further was to get a patient to get MRI, just to conduct with without contrast, able to help us to rule out the meniscus tear or any damage that has caused around the knee. Medication wise, that came out to give was naproxen, given at 500 milligrams by PO twice a day, just to manage the pain. And if there's any inflammation going on, it can take it can also help out to decrease the inflammation. I decided to DC or discontinue the ibuprofen that he is taking, just because we don't want any duplicate of NSAID, which also can cause harm to the gastric line. Based on that, the ice therapy also was used to use ice rest and then elevate it. Based on education that I intended to give was to use the rice therapy, to use the ice to do like between 20 minutes, 3 to 4 times a day, just to subside or to reduce if there's any inflammation going on, and then reduce the pain. And also taking the NSAID with medication, with food, to prevent any ulcer that can cause to the gastric liner in him. So based on the diagnosis and then the plan and the education that we all provided to the patient. So that is the end of my case and an experience I had with the patient today. Thank you so much for listening, and thank you for watching. Good night.